All right, so we are going to get started tonight. I want to welcome everybody for another, another great evening that we're going to have. I wanted, before I even announce anything, it's been extremely stormy in South Florida the last few days. We had 10 inches of rain yesterday, and today we're having big lightning and thunderstorms here since a few hours ago. But anyway, I want to say good evening to all and welcome to another MS Views and News virtual program. So tonight, we're doing these virtual events in these unprecedented times because we just can't get out there again right now to do our live in-person programs. So, again, we're doing these programs virtually, and even after, things start opening up to the point where we can do in-person programs, we're still going to continue with virtual programs as well. So these are going to be around for quite some time. Tonight's program is called the Compass to Care MS Forum. And originally this program was going to be an in-person program in Orlando, Florida. And we were going to do it the night before CMSC was to begin. CMSC would have been beginning tomorrow. But again, we're doing it all virtually now. So, and in fact, for anybody that doesn't know, CMSC is also a virtual event. And if you want to know more about that, then you can either write back with us later on or tomorrow morning, or you could go online and find it there as well. All right, so tonight's program. So I want to let you know, sorry about that. My name is Stuart Schlossman. For those that don't know, I too have multiple sclerosis. I'm president and founder of MS Views and News. All right, and tonight's event, again, the Compass to Care, Compass to MS Care. This is supported by Mallinckrodt. Mallinckrodt is a pharmaceutical that makes Acthar gel, which is used for MS relapse, which happens to be one of our topics this evening. All right. So to begin with, though, we have Gretchen Hawley. All right. And Gretchen is our first speaker. All right. And Gretchen's going to be talking for about 30 minutes. All right. And then we're going to do a Q&A. So for her Q&A, a lot of people sent in questions. I have 5 pages of questions here for Gretchen that will hopefully get through them all in about 30 minutes. And for anybody else that has questions to ask, you'll be able to see them online. Now, before I even get any further into this, I want to introduce Bill, all right? Because Bill's going to show you a few tips about how to use this site right now, okay? So take it away, Bill.
So if everyone's looking at the screen at the moment, you see where the red arrow is pointing? That is a bar that you can actually use to adjust your size of your cameras or the PowerPoint. As you'll see here, in the next slide, you can adjust it to this size or a little bit larger, and then third size. So you can move that up and down based on how large you want the PowerPoints or the cameras. Now, the next thing is when you guys are ready for questions, there's a question box on your right. And if you see right here where the red arrow is pointing, that's where you'll type in your questions. When Stuart comes online to ask the questions, he'll be answering the questions that you typed in during the program. And that's all.
Great. Thank you. Thank you, Bill. All right. So let me tell you a little bit about Gretchen. There's very little bit. Okay. So Gretchen Hawley has a company called The Missing Link, and she has been working with MS patients for, I believe, 6 years now. So she's got a great talk, and we're going to let her get started. Again, she's going to speak for 30 minutes, and then we're going to take questions. And I'm going to call out the questions, whether you fill them here in online or I have them on paper already from what you sent earlier in the day, and since you registered. And then our next speaker will be Connie Easterling. And Connie Easterling is going to speak about brain health and MS, MS relapse, and staying healthy. But again, back to Gretchen. Gretchen's going to speak about physical therapy with multiple sclerosis, resilience, movement, and neuroplasticity. Right? And she's going to do all that in 30 minutes, right? Okay, so let's get started. Take it away, Gretchen.
Yes, I'm going to do my best. So as Stuart said, I am a physical therapist and also a multiple sclerosis specialist. I have been treating people with MS for 6 years, and I fell in love with treating people with MS from the very beginning, because one thing that I picked up on right away is how different MS is for each person. And even with each person, your symptoms can be different day to day, even hour to hour. And I love brainstorming various ways to help each individual person. However, even though MS, as you know, is nicknamed the snowflake disease, it's so different for each person, I have noticed that there are specific things that apply to everyone with MS. So that's what I want to share with you guys today in this presentation. And just for starters, if you did just sit down, go ahead and move your arms a little bit out. You can do the chicken dance. There's so much research proving that we actually retain more information when we're moving and when it's more active participation versus passive and just sitting and learning. So at any point throughout this presentation, if you need to stand up, go ahead and stand up, or move your elbows, move your arms, especially if you feel like you're getting a little sleepy. Over here on the East Coast, it is 6 p.m. So keep that in mind. You're home, no one can see you. Take those movement breaks whenever you need them. So this is our roadmap for our presentation today. So first and foremost, I'm going to talk to you about neuroplasticity and resilience. Resilience is so important with multiple sclerosis, and it ties in so closely with neuroplasticity. So we're going to start there. Then we're going to be moving into exercises that will improve your coordination, strength, and balance, with the main goal of walking better. But even if you're someone who doesn't walk, these exercises will still help you with day-to-day movements. And then lastly, we're going to talk about at-home exercise options, which is perfect for right now. I think they're always perfect, but especially because of the pandemic that's going on. So let's go into neuroplasticity. There's a lot of things that need to happen in order for our muscles to move. So as you can see on this screen, first, your brain needs to have the thought of, Gretchen, flex your muscle, or Gretchen, lift your leg up. But as soon as it has that thought, then it has to go through the nerves. It travels through tons of different pathways to get to that muscle. And then the last thing that happens is I lift my leg, or I flex whatever muscle it was that I was trying to activate. So there are multiple areas that issues can arise. The issue can be in the brain, or it can be in the nerve, or it can be in the muscle. And with MS, 9 times out of 10, because MS is a nerve disease, that the myelin is being attacked, that middle section where the nerve is where the issue is. You will have the thought of, Gretchen, lift your toe up so you don't have foot drop. But if that connection isn't there, then that muscle can't work. So that brings us into what neuroplasticity is, because there is something that you can do about it. It's not just, oh, that movement doesn't work. Okay, I guess I can't do that anymore. It's exactly the opposite. So neuroplasticity is the ability of our brains to find and create new pathways. So if I go to lift my leg and there is no movement at all, then that means that that pathway from my brain to my leg didn't work. So I try it again, and then my brain tries a different pathway. So I like to give an example of this using my arm, just because that's what you guys can see right now. So I'm just going to shift my chair a little bit. So let's say that I want to bend my elbow. If I try, on my very first try, I say, bend my elbow, and it doesn't move at all, that means that if this is the point of my brain that needs to fire, and it needs to travel some way to get to point B to bend my elbow, well then on that first try, that pathway didn't work. But guess what? If I try a second time, my brain is not going to do that same pathway. It's going to find a different one. And maybe it didn't work again. Then maybe it's going to do some swirlies. Still didn't work. Every single repetition that you try to bend, your brain is trying to find a different pathway to make that connection from point A to point B happen. So it might be on your 2000th try that maybe it's a zigzag and it works a little bit and it slightly bends. It's not miraculous. It's not going to be a big bend, but it slightly bends. Well, then that means that that pathway, that zigzag, it worked. So every repetition from there on out, your brain is going to keep doing that pathway and strengthening the pathway. So a big question that I get a lot as a physical therapist is, I want to strengthen my muscles. And while your muscle will strengthen from that, a lot of MS-specific physical therapy is more than just about strengthening the muscles. It's about excuse me, it's about strengthening that pathway from point A to point B. And the only way to find that pathway is through repetition. So even if you have zero movement, maybe it is with bending your elbow, or maybe it's with lifting your toes up off the ground, or lifting your knee up. Even if there's no movement in those, if you keep practicing, your brain is doing work behind the scenes to find a pathway that will work. With that said, let's say I go to bend my elbow and it does bend, but it's just really slow, it's hard, it's heavy, it feels like there's lots of resistance. What that tells me is that there is a pathway that's working from point A to point B. Wherever it's going, it's working, but it needs to be strengthened. So a lot of people will say, oh, that's so heavy, that's so hard, I can't do it. I'm not going to do that as an exercise. Whereas again, you should be doing more of that exercise because every repetition, you're strengthening that neural connection. So that's what neuroplasticity is. And it's an amazing thing because neuroplasticity does not happen in all diseases. It is not something that we should take for granted. And it is the reason that someone with MS actually can get stronger, because behind the scenes, your brain is actively trying to find a pathway that will work to strengthen your muscles. And it's a little bit tricky because there's no research yet that indicates how long that takes to happen. It might take days, weeks, months, years, decades. We don't know, and it's different for every person. But the thing is, the only way you will find that pathway and strengthen that connection is if you practice. And that can be really discouraging at times because you might be practicing a movement and it's really hard. So I think knowing what neuroplasticity is and understanding how good it is for you is a key to having better resilience, because on those days that you want to give up, or if you want to give up after your first repetition, knowing, okay, if I keep going, my brain is at some point going to find this pathway that can help you keep going. Maybe instead of 1 rep, you do 5, or maybe instead of 5 reps, you do 10, whatever it is. The last thing I want to mention about neuroplasticity is that while it's an amazing thing, it also can be used in a bad way. For example, let me back up. If I am trying specifically to bend my elbow to feed myself, then if I am practicing this movement, but my elbow's veering in for whatever reason, because of weakness, muscle imbalance, whatever, if this is happening every time, I'm training my brain that this is what I want it to do. Whereas that's not true. This is what I want it to do. So one big factor, and we'll talk about this in a little bit, one big factor with neuroplasticity is you have to be practicing the form that you want. Don't settle for, that's good enough, it looks a little wonky. We don't want that, because then you'll get the wrong behavior and the wrong movement. Okay, moving on. I feel like I could talk for days about neuroplasticity. Another exciting thing about multiple sclerosis and exercise is that when we exercise, everyone, MS or not, there is a protein called the brain-derived neurotrophic factor, also abbreviated as BDNF. And this is released in our bodies when we exercise. And this protein actually supports the survival of the existing pathways that are there, as well as encourages growth of new pathways. So if this pathway is not working, this protein will help neuroplasticity happen in a way, because it does support new pathways, new synapses. Additionally, this protein also has is associated with cognitive improvement and alleviating depression and anxiety. And an amazing thing that I like to point out about exercise is that research proves it only takes 20 minutes of exercise for this protein to get released, as well as to reduce the body's inflammatory response, which I want that to sink in for a bit. 20 minutes of exercise is what it takes to reduce the body's inflammatory response. That's so important because so many people that I talk to, at least, feel like it's not even worth it if I can't do an hour, or it's not worth it if I can't exercise for at least 30 minutes. That is false. It only needs to be 20 minutes. Next slide. So there is actual MRI evidence that proves everything that I just said. It's not just this research that sounds nice and fluffy and optimistic. MRIs are actually proving that people who are more fit and exercise regularly have less damage in those parts of their brain where damage exists. Additionally, those people who are more fit and exercise consistently, and I just want to point out, exercise consistently doesn't mean going for a run. It doesn't mean running a marathon or, exercising for an hour a day. It just simply means moving consistently. So MRIs also show that people who move consistently have improved recovery from MS attacks and or exacerbations or relapses, and there is preserved neuronal integrity for reduced long-term disability, meaning it's preserving, again, those neurons and those pathways that are there. So it's not just this information that sounds really great, it's actually proven in research for neuroplasticity and via MRIs. Next slide. Functional exercise, I'm just going to briefly touch on this. It is so important, though. There are a lot of people who come to me for physical therapy who have MS, and they have said that they've done PT before and it didn't work for them. And 9 times out of 10, the reason for that is because they went to a PT and they put them on a bike for 20 minutes, and then they did some clamshells, some side-lying leg raises, some straight leg raises, exercises like that. Those are not functional exercises. Now, the bike is a functional exercise if your goal is to ride a bike better. But if your goal is to walk better, biking will not help with walking. A functional exercise for walking would be walking and breaking down those movements, which is what I'm going to explain on the next slide. So I just want to point that out. If you have a goal of standing up better from the ground, then you should be practicing standing up from the ground. And what a PT can help with is helping you break down that movement so that you're not starting on the ground. Maybe you start on a mat table or your couch and you work on those strategies at an easier level, and then you work from the ground up. Or if you have a goal of standing up from your toilet a little bit easier, there are exercises that are specifically functional for that. So I just wanted to point that out as well. Okay, I love talking about walking because a lot of people that I work with have a goal of walking better. And I'm just going to back up so that you guys can see what I'm doing. My dog Finn is in the way, so hopefully he'll get out of the way. Okay, so what I want to show you is that when you're walking, I'm just going to demonstrate what you see on the screen there at the bottom of the screen. So walking requires that you shift your weight forward, that you bend your knee, that you swoop your toes up, that you bring your knee up, that you straighten your knee, and then that you place your heel down. And all while that was happening with this leg, I was standing on one leg. So that's 7 different things that you need to do in order to walk better. And I think that's really important to understand because a lot of people have a goal of walking better, so they only practice walking. However, as I just pointed out, there are 7 different movements that you need to have strength with. And if any of those are off, your walking is going to be off. So again, a physical therapist can help analyze which of those things, or maybe you know, but it's important to analyze which of those things are limiting you the most, working there, and then building yourself back up. So when it comes to walking, sometimes it's more balance oriented, sometimes it's coordination, sometimes it's strength, sometimes it's all 3. So what I want to do, and I believe this is the next slide, but what I want to do is take you guys through 3 different exercises. Perfect. The first one is strengthening. So I'm going to demonstrate, and I want you to practice now if you are in a safe environment. I don't want anyone risking their safety or feeling like they're going to be tippy or fall over. Make sure you're staying safe. But we're first going to cover a strengthening exercise. We're also going to cover a coordination exercise and a balance exercise. So it's one of each of those pieces that is required to walk. Now, if you don't walk, maybe not often or maybe not at all, these are still really good exercises for you, and I'll explain why as we're doing them. So clear a little bit of space around you if possible, and I am actually going to do this with you. Okay. And actually, I'll show you from this side. Okay, so this exercise, you're going to lift your leg up off of the ground and then slowly put it back down. And as you can see, I'm in the middle of my chair, which uses my core muscles, but it does make it harder. So you feel free to recline if that makes it easier for you, but you're just going to go up and down, little pause at the top, and then back down. Now, what I am assuming is happening over there is one leg is not lifting as high. And that's okay. Maybe one leg isn't lifting at all. I want you guys to keep going. I'm just going to talk to you as you're doing it. If one leg is not lifting at all, keep trying. This is exactly what I'm talking about with neuroplasticity. Even if there's no movement, keep attempting to lift it up each time. If one leg moves, great. If the other one hardly moves, keep practicing, keep going. So I wanted to point that out because that's where a lot of people miss the boat is, oh, my leg's not lifting at all. Let me just do my right leg or whichever leg is stronger. And the reason that this exercise is great, number one, if you're sitting in a position and you need to move forward, you need to lift your legs up like this. Obviously not as far as what I'm demonstrating, but you do need to lift your legs up to scoot forward. To get out of a car, if I'm in a driver's seat right now, or even passenger seat, to get out of a car, you have to lift your leg up and then lift the other leg up and out. So this seated marching is so functional, even to get into or out of bed. Now, the advanced version of this would be standing. So you can try this if you're safe at home right now. You can hold on to something. It would be standing, marching like this. And the reason for that is because when you walk forward, we need to march this way. However, balance, as you can see on this slide, is another big thing that we need. Even if you use an assistive device, maybe you use a cane or a walker, a rollator, the trekking poles, whatever it is that you use, those assistive devices are not meant to bear our full body weight. If you put your full body weight through those and it's a slippery day outside, or maybe for whatever reason it just moves away from you, you're gonna fall on your face. So those are only meant to assist with balance, but not to fully compensate for weakness or imbalances that you have, meaning you still need to have balance of your own. So that's why it's important to practice balance. So I'm gonna show you from the front just so you can see. As I was walking forward, this leg is in the air for 40% of our gait. So what that means is that I need to be able to balance on this single leg. So holding on to things, balancing on one leg, make sure your knee is slightly bent, not locked. And can you let go with one hand or both? And this is the hardest version of balance. You can see I'm a little wobbly today too, but this is the hardest variation. There are so many variations that your physical therapist can work with you on. There's starting out wide. Also required to walk is staggered stance, feet together. So if you can't do this, or if it's very challenging, that's okay. I'm just giving you an example of one thing that is required for walking, and that at some point, it might not be today, it might not be this year, but at some point, this would be something that you would be working on. The last exercise I want to show you is proprioception, also called coordination. And this is really important because you may have noticed that when you walk, maybe your leg doesn't always go in front of you where you want it to go. Maybe sometimes it crosses, or sometimes it comes out here. And 9 times out of 10, the reason for that, well, sometimes it's due to spasticity or tightness or muscle weakness, but a lot of the time, it's due to coordination. So basically meaning your foot doesn't go where you want it to go. And you can actually train that. So in a standing position, which this is harder, I'll give you a seated demonstration too. In a standing position, you want to find something on your carpet. This works perfect if you have a carpet that has a design on it. But if you don't, maybe put a piece of tape on the ground or a book or something. And what you're going to do, you're going to lift your leg up and place your heel on that object. Not your toes, just your heel. And then bring it back. And then place your heel on it again. And you want to make sure that that point that you're touching is in front of that leg. It's not in cross, so it's in front of you. It's not over here. It's not over here. It's directly where you would want your foot to go if you were walking forward. And same thing, you'd want to practice this on both sides. When you're sitting, you move this down just slightly. It's the same thing. So you're sitting, I know you can't see my upper body, but that's okay. You're going to lift your leg up and tap. It shouldn't be so far away that your leg is fully extended, but you're lifting, tap, then back, tap. And this trains your body and your coordination so that when you walk, you will be able to place your foot where you want it to go. And as I mentioned, there are some other factors like spasticity, but this is a great exercise to assist with walking. Okay, we can move to the next slide. I hope you guys enjoyed those. The newest guidelines are showing that if you do aerobic exercise first, that actually primes your brain for neuroplasticity. So it's not only an amazing thing that neuroplasticity exists for people with MS, but you can actually do something to help spark it, and that's aerobic exercise first. I have not seen any research yet that indicates how long the aerobic exercise needs to be. So unfortunately, that's not out yet, but my best suggestion, do some aerobics. Some is better than nothing, and that's going to prime your brain for neuroplasticity. The second thing, every exercise that you're trying to get better at has to be high repetitions, because every repetition you do is a chance for your brain to find a pathway that works. And it also has to be perfect quality, because if I'm practicing that coordination exercise, but instead of placing my foot right in front of my leg, and I'm instead placing it across my body, you better believe that when I start walking, I'm going to be walking scissor, and it's called the scissor gait, because my legs, I trained my leg to place it down across my body. So it has to be perfect quality, exactly the movement that you're looking for. And those things, perfect quality and high repetitions, mean you have to take rest breaks. Don't see rest breaks as a failure. I have some clients who I basically make them take a break every 5 minutes, even if they don't feel tired. Or I'll make them take a break after 10 repetitions. Again, even if they don't feel tired, if I notice that quality is lacking, or it's just not the movement that we're looking for, take a break, rest, and then continue. So it has to be lots and lots of rest breaks. Next slide. There are also ways that you can exercise more effectively. So the first, this is my favorite one. Distributed is the same as massed, which what that means is if you exercise throughout the day, that is just as effective as exercising at one point. And that's really important because, again, I have a lot of clients who say, I don't have 20 minutes to exercise all at once. Research is now showing if you have 5 minutes after breakfast, 5 minutes at lunch, 10 minutes before dinner, that was 20 minutes, right? That's 20 minutes still, but it's distributed throughout the day, just as good. The second thing is a variable environment is better than constant. If you are trying to get stronger standing up from a chair, try standing up from your couch, and then your bed, and then your toilet, and then your dining room chair, and then a kitchen chair, all the different chairs, as well as at work, at a friend's place. Well, this time of year, we're not going to work or friends' places, but you get the idea. Practice in your bedroom. Practicing in different rooms is different environments, and that's better. Our brains will grasp that exercise easier. And lastly, random order is better than blocked order. So what this means is doing things out of order. Like if you want to be able to walk, I pointed out those 7 things, don't always do them in the same order. Switch it up. And that's into random order versus the blocked order of every time the same order. That's going to be the most effective way for your brain to understand and get these exercises and your body. So this is just something I threw in here. I felt like this is really important information to relay to any of your doctors. Maybe it's your primary care physician, maybe it's your neurologist, maybe it's your physical therapist, occupational therapist, anyone that you're working with. I want you to write these things down or take a screenshot or a photo of the phone, of the computer, because these things, if you don't mention them, I have found that if you either don't mention them or don't talk about them in the right way, you won't be getting the best care. So fatigue, it's really important to mention, if you're feeling it, what brings it on? Anything or nothing? What makes it go away? Maybe nothing makes it go away, or maybe there is something, maybe cooling yourself down. So what makes it come on? What makes it go away? And also, what does it feel like? There's a big difference between primary and secondary fatigue, and it's so important that your doctors understand which you are dealing with. The second thing is falls. A lot of people tend to think a fall is just if it was a heavy fall. But I want you to keep in mind that as much as it's hard to admit sometimes, if you fall on the ground, even if it was slow and controlled, maybe you were against the wall the whole time, holding on, no injuries, everything was fine, and then you got up okay, it's still considered a fall. And I also want to point out that a near fall, which hopefully all of your doctors are asking you about, a near fall means you didn't fall, but you almost did. And those things are really important for at least physical therapists, as well as your other doctors, to know. My plan of care for you, my exercises that I give you, are going to be so different if I think, oh, she only fell once this last year. Ideally, that'd be 0, but that's fine. Versus, she actually fell 3 times this year, and she is near falls several times a week, but she catches herself. My plan of care is going to look so different, and therefore you're going to get better with those exercises versus if I have the wrong idea of your falls and your balance. The other thing is spasticity and tightness. Where is it? Point to where it is. How intense is it? What does it feel like? What does it limit you from doing? Also, from all of these things, from fatigue, from falls, spasticity and tightness, how is your day impacted? Because at least as a physical therapist, this is where my goals come from. It's very different if you were to tell me, yeah, I have some spasticity, and I say where, and you say behind my knee, but it's okay, versus, Dr. Gretchen, I have spasticity behind my knee that prevents me from getting into my car. And because I can't get into my car, I can't make it to my doctor's appointments. Or I have fatigue so bad that I can't get out of bed in the morning, and that's why I'm not making it to my appointments. Or because of that, I'm skipping work so often, and now my boss is mad at me. There are exercises that you can do for fatigue, believe it or not. I know that sounds counterintuitive. So lastly, it's so important to mention your goals. If you have let me back up. The reason for this is because some physical therapists have very clinical goals. Your strength will be a 4 out of a 5. You will be able to balance for 15 seconds in this position. However, what's more important than that clinical stuff is that you actually are improving your function throughout your day. So it's very important before you go to your appointment, write down, what are your goals? 9 times out of 10, when I ask people this, they don't have an idea. So just think about it. What activities are hard for you to do? Putting on socks, putting on shoes or pants, balancing while putting on pants, getting into your bed, climbing stairs, walking. If so, what about walking? So just thinking about all of these things and jotting them down before you go to your appointment is going to help you get the best care, whether you're at your PT, your neurologist, or any of your doctors. Next slide. So I just briefly wanted to touch on some home exercise options for you. There are a ton of things that you can do for free, which is amazing right now. So the first thing I thought of, which is more higher level, the first 3 things are higher level. Hopscotch on your carpet. If you have patterns, make a game out of it. That's going to get your cardio up, your heart rate up, and it's going to be such a great exercise for cardio, for balance, for strengthening. Also, I don't know if you guys have heard of this scientific 7-minute workout. It was published in the New York Times. I got it. It's probably over 10 years ago now, but it's this 7-minute workout that is scientifically proven to be an effective workout. So that's another good one to look into. Another one is jumping rope. I don't know about you guys. I find jumping rope so hard. Jumping in general is really challenging, again, for balance, for cardio, for strength. So if you consider yourself more of an athlete style and you want to try that, that can be another great exercise that you can do, and it's fun. Another one is stair climbing, and this is such an effective exercise, especially if you have a goal of climbing stairs better, maybe not using your arms so much, maybe bending your knees a little bit more, so you can use it for that, but also if you are good at stairs, go quickly. How can you run up your stairs? Can you jog up? Can you just go a little bit quicker than your normal pace for walking upstairs? Stairs are a great way to get some free exercise at home, up and down. Make sure when you go down, you're slow and controlled. Dancing is another one. Play your favorite music, and literally you can just dance in your chair, and that'll get your heart rate up. It doesn't have to be anything that is out of the ordinary. And then upper body weight training. If you don't have weights, you can use water bottles, cans of soup, YouTube workouts. There's so much on YouTube that you can do. You can search for any type of workout on there, and there'll be anything from 5 minutes to probably 2 hours of workouts. And then I think I have one last slide. So, and this is just if you wanted specific MS exercises. I do have tons of free content on YouTube, Facebook, and Instagram, and you can follow along with those. There's strategies for exercises as well as symptom management, ways to manage your symptoms that are beyond exercise. And then the ones at the bottom are for a fee. I have an online program, telehealth PT, one-on-one wellness consults, and home visits. But there is so much that you can do. I hope you feel empowered and like you have something that you can work on right now, especially during this time. So I hope that was helpful. I think that was my last slide. Is that my last slide? Yes. So, Stu, take it away.
Great. That was awesome. I started to speak and I realized I was still muted. Oh my gosh. So let's thank everybody. Give Gretchen a round of applause. Yay. Heads up. All right, cool. That was a virtual round of applause. All right. Hey, for everybody that's online right now, I mean, there's a lot of people on. We have a lot of people online. That's a great thing. So we just heard Gretchen. Gretchen's been speaking for the last 30 plus minutes. And my name is Stuart Schlossman, president and founder of MS Views. I too have MS. We're going to now ask Gretchen questions, all right? So a lot of questions came in while people were registering for the last couple of weeks. And also I see that we have a lot of people also writing in online. And even there are people saying, excellent, Gretchen, and thank you, Gretchen, and wonderful speaking, and blah, 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 blah. So let's get into some questions though, all right? One person, I'm not going to give any names, okay? Everybody out there, I'm not going to say your name. We didn't, I didn't get any privacy things, and I don't want to list people's names unless they tell me it's okay. So to start off with, a person writes, I'm a 50-year-old single woman living alone with her MS, and is there any support available for somebody like her?
The very first place I always suggest is the MS Navigator or the consortium of MS centers. There are MS Foundation, MS Association of America. If you haven't already, I would reach out to those organizations that can really help with support for in your home. And it depends what you're looking for, but there's so much that is offered, ranging from cooling vests or transportation. So I would suggest reaching out there. Perfect.
All right. Next, we have a person saying that he or she is too tired after exercise. She wants to know, can I do exercise before bedtime?
So I'm glad that you asked that question, because a lot of people with fatigue feel like they shouldn't exercise or they just can't. But research proves that even with fatigue, exercise can help. And I want you to retrain your brain with what you think of as exercise. Exercise can simply be what we did in the very beginning of this call, where you're sitting up tall and you're maybe doing bicep curls, or maybe some punches. That is exercise. And if you suffer from extreme fatigue, that is the type of exercise that I typically start with. Again, there's tons online. I have a whole YouTube video on seated exercises for fatigue. But when you have fatigue, movement is one of the best things you can do, but it has to be limited and a little bit easier so that you can do it and you don't over fatigue yourself. So if your best time is before bed, go for it. If you're most exhausted before bed, I wouldn't suggest that time. But if that is when you have your peak time, then yes, that's fine.
Great, thank you. So another person writes, if one leg is not working for seated marching, should I use my hand to lift my leg?
Absolutely not. Great question, because so many people do that. No, no, no. If you do that, you're using your arm strength. You're not even using your hip flexor strength, which is what you need to lift your leg. So your arms will get nice and jacked. You'll have nice bicep muscles, but you're not strengthening the muscle. So I would actually rather you have no movement, practicing that exercise with zero movement, than I would see you have good movement, but using your arms, because you're training the wrong muscle groups at that point.
Thank you. Next person, are there any supplements we can take of BDNF? Do you know what that is?
BDNF.
Okay. Well, for those that don't, she or he wrote brain-derived neurotropic factor. All right.
Yes.
So are there any supplements we can take of this that can stimulate the body to make more of the brain-derived neurotrophic factor?
Great question. To my knowledge, no. I'm not sure if our next speaker, Connie, would have anything to say about that, but to my knowledge, I'm unaware of anything that you would be able to take. That's something that our bodies produce, so I am unsure. To my knowledge, no.
Okay, another person writes that I think Dr. Gretchen said on IG that standing is a good exercise. Are there any specific tips for forms or a length of time for that?
So standing is one of my favorite exercises. A lot of people underestimate how powerful of an exercise standing is. If you're standing specifically without holding on to anything, even if you have a really wide stance in order to do that well, that means that all of your muscles are working evenly. If they weren't, if your muscles on your front were weaker than the other side, you'd topple forward. Or if your muscles on the back side were weaker, you'd fall backwards. So simply standing, you're using a ton of muscles and you're working on balance. So there's no, as with MS, I say this all the time, it's different for everyone. If you can balance for 5 seconds, then you need to hold on, great, start there. If you can balance for a minute, great, start there. Can you do a minute and 20 seconds? Standing can be good for circulation as well. So it depends what your goal is with standing. If it's more than just balance and circulation and endurance, then see maybe if you can balance for up to 5 minutes. But again, 5 seconds is a great place to start. It doesn't have to be a long time. It can be any time.
Perfect. Thank you. Next person, I know I need to move more, but when I do, my right leg becomes fatigued quickly. I have a Bioness L300, but I still get tired. It's also summer now, so the weather is uncomfortably warm. All of this on top of quarantine has me feeling down. What do I do?
One of the first things I tell all of my clients to do, especially this time of year, but even if it's not this time of year, is always check to see if there's a possibility that one of the reasons you're feeling extra fatigued or bogged down or heavy or weak is from the heat. Because exercise increases your core temperature, which can cause heat intolerance, let alone the outdoor temperature. Or even if you are inside, but it's a really hot day outside, the barometric pressure can increase your heat intolerance. So that is the first thing I tell everyone to think of. And the answer could be no, that I don't have heat intolerance, and that's not one thing that might be worsening my symptoms. But if it is, it's such an easy fix. So having ice cold water, making sure before you do whatever it is, going outside, your exercises, making sure you have some type of cooling system. Maybe it's a vest, maybe it's a neck wrap, maybe it's a blanket, some ice cold water. So I hope that answers your questions. That's the first thing that I would suggest.
Okay, thank you. Before I forget, somebody asked me to let them know about an online program that we're doing tomorrow. We're not. We don't have an online program tomorrow. So Gretchen, are you doing an online program tomorrow?
Nope.
Okay, well then it's not us, so I can't answer that. But we do have online programs coming next week, 2 of them, and I will let people know about that later on. Okay, so next question. I do Tai Chi on YouTube. What do you think of this for MS? It's for beginners.
Tai Chi is great. I'm a huge advocate for do what you like. If doing something is going to be better than doing nothing at all. And Tai Chi is really great for balance and core strength too. So I am pro Tai Chi.
Great. I just got a Spirit CRS recumbent bike. It's similar to New Step, but thousands less. It's 20 minutes 3 times a week. Is 20 minutes 3 times a week a good starting point?
It depends what your goal is. If your goal is, and let me say, I like recumbent bikes for cardio exercise. It's great for that. But if your goal is walking better, I would actually prefer that you do walking exercises more than the recumbent bike. But if your goal is just cardio and let me get my legs moving a little bit, then 3 times a week for 20 minutes sounds good. But again, it depends on what your goals are.
All right. Primary and secondary fatigue. I have never heard of that. What is this?
So important. Primary fatigue means you can't think of an external reason that you would be tired. You didn't go out last night, you got a great night's sleep, you're not stressed, but for some reason, for essentially no reason other than your MS, you're fatigued, you're bogged down. Some people say it's so hard to even open their eyes, they're so tired. So there's no reason for it, no cause that you can think of outside of having MS. And secondary fatigue means there is a reason for it. You are stressed. You didn't get a good night's sleep. You overexercised. You were out and about. You were up all night, whatever it was. Secondary fatigue means there is a reason for it. And again, to reiterate, because it's so important, exercise helps with both types. It just has to be the right type of exercise.
Great. Thank you for that. So a person from the Midwest writes, how to beat heat fatigue. I live in the Midwest and the humidity is starting. Hey, let me tell you something, whoever wrote this, you need to come to South Florida or go to Houston, all right? You'll understand humidity and you'll think then where you live is nothing, okay? But Gretchen, please answer that. How do they beat the heat fatigue?
So beat the heat, I would always suggest be proactive. As soon as you get out of bed, if you know it's going to be a humid day, as soon as you get out of bed, sipping ice cold water, not just cold water or room temperature water, ice cold water, just small sips throughout the day, all day long. Additionally, if you have, again, a cooling vest, a cooling hat, a cooling wrap, a cooling neck wrap, there's so many, if you just Google it, there's so many different cooling devices. Wear one all day long, be proactive, and especially be taking those same precautions, ice cold water and cooling devices, when you're moving, even if it's just moving around your home, if you're cleaning your bathroom or something. Those are the best ways to cool your core temperature down.
I wish I had an MS Views and News ice pack thingy to show you right now. That's my favorite, okay? Take it, put it behind the back, and you cool down instantly.
Yep,
okay?
Get a bunch of them, throw a bunch in the freezer. As soon as one's not cold anymore, swap it out.
That's right. That's right. All right. Another person writes on, I have been unable to go to physical therapy. What are some exercises I could do at home that will help with extreme leg weakness?
Great question. However, it depends where your weakness is. If your weakness is lifting your leg up, you want to be practicing lifting your leg up. You can make that a little bit, you can do that in a seated position, in lying down on your back with your knees bent, lying down on your side, standing. So just that one exercise, there's so many positions that you could do it in. If your weakness is with bending your knee, again, seated, bend your knee, pull it back, or lying on your side, bending your knee. If it's ankle dorsiflexion, literally, the thing about MS that makes it somewhat a little bit easier to treat is whatever is hard, do that as an exercise. And if that's too hard, still do it, but find a position that makes it a little bit easier. And that's sometimes where a physical therapist can come in, but just kind of play around with what you can do at home. Try something lying down on your side. That sometimes makes it easier because you're taking gravity out of the equation.
Great, thank you for that. By the way, for those that are watching, I just want to let you know that we have about 15 minutes left of questions, if we get that far, and then Connie Easterling will be coming on, okay? Next question. What exercise or stretching can we do at home to reduce neuroplasticity?
To reduce neuroplasticity?
That's what they wrote. What can we do at home to reduce it?
I think they mean to reduce plasticity.
Well, yeah, okay, but that's, whatever. It was just written a little wrong, that's all.
Yeah, so there are, again, it's different for everyone, but there are 2 different types of stretching. Type 1 is dynamic stretching, meaning you hold the stretch for about 3 seconds and then let it go, and then go back into it, hold for 3 seconds, and then release, and then back into it. And you do this about 30 times. So it's stretch and then off, stretch and then off. The other type is static stretching, which requires you to hold it for at least 20 seconds. So I actually tell all of my clients to hold it for 30 seconds because we have a tendency to count too fast. So static stretching is go into the stretch, hold for 30 seconds, and then back out, and then go back in. And you do that 2 to 4 times. So I say 3 because that's in the middle. So I would suggest trying both types and see what feels better for you. For some people, they feel more flexible and less spastic after dynamic. And for other people, it's static.
Great, thank you. Again, to cut in, somebody wrote that the person that wanted to know what the event is starting tomorrow, CMSC, that is the Consortium of Multiple Sclerosis Centers, and my name is Stuart, not Paul. Thank you. Paul Pelland is a different person. Okay, so thank you, though, Gretchen, for your answer. Now, here comes a good one, all right? What are ways to increase endurance, increase strengthening, and how best to, what are the best exercises to increase strengthening and endurance? How's that?
Great. Okay. So again, it depends what you specifically want improved strength with. Do you want improved strength? And some people just generally want improved strength. However, with MS, the most important thing is, do you want improved strength with standing up from the ground, or improved strength with climbing stairs, or with getting up off of your couch? And same question for improved endurance. If you want improved endurance when walking, then you've got to practice walking. Or if you want improved endurance on the new step or some type of recumbent bike, then you would do the new step. But for endurance, my best advice is, for whatever activity is you're hoping to improve endurance with, do that activity for as long as you can with good quality, and right until you get to the point of fatigue. Don't push into fatigue, stop and rest. And then as soon as you feel, okay, I can do this again, do it again, and then stop and rest. So it's different for everyone what that time frame looks like. And same thing for strengthening. If you want to improve the strength with stair climbing, practice climbing up the stairs. If that's too challenging, break down all the movements that are required to climb up the stairs and practice strengthening those things versus the whole movement altogether. I hope that's
great.
Okay.
That's good. Thank you. I've lost my motivation for staying active. Any websites to get me motivated again?
Oh, that's a great question. I don't know of any websites right off the top of my head, but what I will say is do something that you like. What types of things do you enjoy? If you enjoy dancing, I'm sure you can find dance. Actually, I know you can because I've seen them. On YouTube, you can find seated dancing classes. Or if you can stand up and dance to music. If you like walking, what types of things do you enjoy? And if you can't think of anything, what types of things might you want to get started that excite you a little bit, that can be exercise? So that motivation at the end of the day has to be something internal. You can find outside resources. I try to use my Instagram and Facebook and YouTube page as motivation and empowerment and excitement. But at the end of the day, that's external, and what's going to keep you going and keep that resilience is finding something that you enjoy and that you like doing. So trying to find something like that.
Perfect. Thank you. Can doing stretches and exercise, okay, that's back to the other one again. So we already did that. That's on spasticity. Next one is about a question that you cannot answer because that's for Connie. And then the next one is how to safely and effectively build endurance, strengthen bones, and lose weight with drop foot and imbalance.
It's a loaded question. I'm going to take that one step at a time. So for drop foot, the best thing that you can do, and this blows my mind that everyone with MS who has drop foot hasn't done this. I'm always surprised at how few people have. If you have drop foot, so I'm just going to demonstrate it this way. Drop foot meaning, if these are my toes are down, this is my heel. You have to practice lifting your toes. Even just in the seated position right now, I'm assuming you're sitting. If you're sitting down right now, lift your toes up, heel stays down, and then slowly lower it back down. And again, even if there's little or no movement, just keep practicing. Your brain is going to try to find a pathway to make that happen. But your foot drop will rarely if ever, improve if you don't actually strengthen that movement. That movement strengthens the muscle that is weak and causing the foot drop. Another thing about foot drop is tight calf muscles. So if this is my toes, heel, knee, this is my calf. If my calves are tight, it pulls my foot down. So that's another reason that people can have foot drop. So yes, lifting your foot up for strengthening is good, but also stretching your calf muscles will allow more flexibility in your ankle. So for foot drop, that's what I would say. Weight loss is so individual for each person. It's always a combination of nutrition and exercise. Endurance, kind of already answered that question. It'd be my same answer as what I said a couple questions ago.
Sure. All right, last one. I broke my right leg March 2018. My left side was weak side due to my MS. I was unable to put any weight on the leg for 3 months. I've been doing physical therapy, but still not able to walk. How can you tell if my PT is not correct for me?
So that's a good question. And it's hard because sometimes, I will say, I've had clients with foot drop who have never done this exercise. I teach it to them, they come back a week later and they can do it. Even though the first day they could hardly lift it. And what that tells me is that connection was there, you just weren't utilizing it. And therefore, now that you're using it, your brain remembered it and now you've got it back. On the opposite end, I've also had people who can't lift and they've been trying for a year and it's maybe slightly better, but it's still not where they want it to be. And that's the piece where we don't know how long it takes with MS, and it's different for everyone, but we don't know how long it takes for that neuroplasticity to find a pathway. But typically, at least with my clients, you said that was in 2018. I don't know, I forgot how long you said you've been going to PT. Within a year of doing your exercises consistently, and that's not to say you need to be with your PT for a year, but you're keeping up with your home exercise program. Within a year, I have typically found that my patients will notice some improvement. And that some improvement might mean I'm still fatigued, but I'm not as fatigued. Or I can climb up 5 stairs better, but not all 13. So it's really important that you look for those small improvements versus I can climb my stairs now, or I can walk a quarter of a mile now, whereas I couldn't before. Can you walk slightly longer? So if you're thinking, if you've been doing something for a year and you aren't any better, you're probably not doing the right thing for you and your limitations.
Great, thank you. One more question, because it came in a few moments ago. There was another question, but it's similar to something that was answered earlier, but I have to go with this one. Would you recommend the use of bilateral NDT type guiding techniques to refine movements for neuroplastic retraining?
Sorry, I just heard Finn behind me. Sure, why not? With neuroplasticity, it's all about getting your muscles to move and getting the movement to occur. So if that's something that helps you, then yes. And I want to point out that that is different than using your hands to help you lift your leg. Using your hands to help you lift your leg is using other muscle groups. Whereas if you're using anything that will help you, even like the walk aid has an exercise mode on it. So you can have it on exercise mode and practice lifting your foot. You're still actively getting that movement. So any type of stimulation, I personally think is fine, as long as in addition to that assistance, you're also actively trying to do the movement yourself.
Great, thank you. Hey, let's everybody give a round of applause to Gretchen for being here.
Thank you for having me.
These are rough times, okay? Our next speaker is Connie Easterling, and before I say anything about Connie, we're going to get her online. There she is.
Yeah.
All right, so back to what this program is about, all right? So my name is Stuart Schlossman. I'm president and founder of MS Views and News. Those have heard that many times before. I'm also an MS patient, yes, and this is an MS Views and News program, okay? We are not anybody else. We are just MS Views and News, all right? We provide educational programs. Last year, 58 educational programs around the United States. And this year, we were on course to do the same until, well, look what happened, right? But we are going to be starting again in the end of June, okay? We're going to start doing a new in-person program with very, very detailed safety guidelines for doing an MS event in person, and that will be taking place in Savannah, Georgia, and Connie will be speaking at that program as well. So before we get to that point, though, I want to introduce Connie real quick. So firstly, Connie's going to be speaking about brain health and MS, MS relapse, and staying healthy today. All right, we do have a lot of questions, and for anybody that has questions for Connie, please start typing them in so we can, have them for later on. Also, Connie works at the MS Care Center in Orlando, Florida. She's been treating multiple sclerosis patients for 28 years. Let's thank her for doing this. I mean, that's a great service in itself, all right? And so I'm going to disappear from the screen now, and we're going to give it all to Connie to speak, okay? Take it away, Connie.
Thank you, Stuart, and thank you for inviting me to speak tonight. The problem with doing it so long, doing MS work so long, is that you never want to quit and you don't know how to quit. My husband and I are in our 70s, and we keep talking about retiring, but it's very difficult to me, or for me, to stop treating patients. Tonight we're going to talk about wellness in MS and a couple of other things. I want you to know, though, first, that wellness and health maintenance go hand in hand. So if you're trying to include wellness in your life, but you're not taking care of that MS, then the two are going to conflict. So I'll have my first slide, or my next slide, please. So this is my schematic of the dimensions of wellness. I adapted this from Dr. Ann Spa, who many years ago did her research in wellness, and I think she's still doing it. But she felt that wellness had 6 dimensions: environmental, physical, social, emotional, spiritual, and intellectual. And it's very true. So your environmental health includes disease management. Your physical health includes some of the things that Gretchen was talking about: fitness, nutrition, sleep. We're going to be talking about those. Social wellness includes your relationships, your intimacy with others. Emotional wellness includes stress management, mindfulness, and we'll talk about that as well. Spiritual wellness includes life, meaning, your values, your purpose, where you get your strength. And intellectual learning has to do, or intellectual wellness has to do with learning. Never stop learning. There's always going to be new challenges, no matter how old you are, whether it's reading different books. But you should always have that intellectual component, because it helps your brain. Next slide, please. Okay, great. So we're going to talk about promoting brain health. There are things that you as an individual can do to maintain the health of your brain. It includes both mind, body, and spirit for you to have your optimal, healthy brain. Even with the presence of a neurologic disease like MS, there are things that you can do to help your brain stay healthy. Years ago, I worked with a physician. Many of you may remember him, Victor Robert, MD. He retired in 2007, but he was the mind and soul of the MS Center that we had. And he always told me, Connie, he would say, 50% of taking care of yourself in MS, 50% is being positive in your approach, not only life, but to having a positive approach to caring for your MS and being well and maintaining your health. Next slide, please. Good. So we're going to talk about maximizing neurologic reserve. That's a big topic now in MS. Neurologic reserve is those healthy areas. And it's kind of like what Gretchen was talking about. It's those healthy areas of the brain that step in and perform the tasks that the damaged part of your brain can't do. So if you have lesions in a particular area in the brain that causes symptoms, your neurologic reserve will sidestep that, and it will come in and help you perform those tasks that you once could do, but that the damaged areas of your brain can't do. So we want our MS patients to have plenty of neurological reserve. And that can keep you from experiencing symptoms. It can keep you from having relapses. Neurologic reserve can decrease as brain lesions occur. So what do we want to do? We want to prevent those development of brain lesions, and we want to prevent those relapses, so we can preserve your neurologic reserve. So healthy neurologic reserve can slow down volume loss, atrophy of the brain. It can reduce lesion damage, and it can relieve MS symptoms. Next slide, please. If any of you know Patricia Coyle, she's a well-known physician in MS. She talks a lot about neurological reserve. So if you have a chance to go look for her on YouTube, and you may catch her talking about that. So one of the things that you can do for your brain is you can improve your sleep. In my center, we work with Naveen Verma, MD. He is our sleep doctor, the doctor of sleep, and he's really good at it too. And so he says you have to have at least 7 hours of restful sleep every night. You have to reach REM. The lack of sleep can lead to trouble with balance. It can lead to cognitive issues. You can get up the next morning, you have poor memory. It only makes it worse. You can have difficulty concentrating and even have trouble finding words. I know I don't have MS, but if I'm tired, especially at my age, I feel some of these symptoms as well. Dr. Verma always says the bedroom is for 2 reasons. One is sex, but one is sleep. So he says, turn off those TVs, turn off the radios, put away the laptops or the tablets. Those should not be in the bedroom. And so you're going to have a hard time sleeping if you're trying to do other activities that stimulate your brain. Next slide, please. Physical activity. I won't go into detail here. I just want to tell you a couple things because this is one of those important things you can do for yourself, and Gretchen really stressed that, but it can improve your overall well-being. So exercise actually increases brain volume. Isn't that amazing? It increases brain volume. So it augments neurogenesis, or it creates new brain cells when you exercise. It increases gray matter volume. So gray matter is a huge topic in MS right now. We now know that MS can actually start in the gray matter before it gets to the white matter. And we didn't know that until now. We have MRI machines that are that can show us the gray matter. And exercise actually prevents atrophy. So aerobic fitness, and those are those things that you do to increase your heart rate. You can do it sitting in a chair. You can do it actively using your legs, like walking. I walk 3 miles a day. But aerobic fitness is associated with improved information processing speed or cognitive function. And exercise can help manage MS symptoms. I know one of the worst patients I ever saw in my center, he came in a scooter and his legs were spastic and they were up to under his chin practically, and he couldn't walk. He hadn't walked in a year, and he was young. He was like 35 years old. So I sent him to Patty Bobrick. Many of you remember Patty. She's living in Colorado now, but I gave him to Patty, and I said, I can give him a lot of pain medicine to manage his pain and his spasticity, but I want to see what physical therapy can do. And he actually came back to me 3 months later, and he was walking with a bilateral assistance, but within 6 months, he was actually walking without assistance because exercise, physical therapy helps to manage those symptoms, and it can do a great deal in preventing pharmacologic intervention. And physical activity decreases depression, and it helps improve mental and physical health. Next slide, please. Nutrition. Nutrition is one of those really key factors in being healthy. They say now that the best diet for all of us, whether you're trying to lose weight or be healthy, is the Mediterranean diet. And there's a lot of reason for that, because the Mediterranean diet limits red meat. It limits eggs and poultry to several times a week. Fish is important in a Mediterranean diet. Olive oil is big in a Mediterranean diet. I have a granddaughter that believes totally in this diet, and she's beautiful. So, and then as you go up the pyramid, you eat less of those things. And at the bottom of the pyramid, you eat more. So you probably think you shouldn't be eating grains and breads and stuff like that. But in the Mediterranean diet, that is an important factor. So we should drink 9 to 13 glasses of water a day. We used to say 8. Nobody ever drank 8. So now we're saying 9 to 13. That is what nutritionists say. So, and eat foods that are low in fat and cholesterol. And you can get that from a Mediterranean diet. Low sodium is so important. And it's more important as you get older. But sodium can be toxic to the body. And it can be inflammatory to the body. So you should not eat high salt diets or foods that are very high in salt. Limit added sugar intake. So sugar can also lead to inflammation. I have a friend who has terrible arthritis even, and she, on days that she is craving sweets, and she goes on that sweet binge, the next day she is in a lot of pain because her joints are inflamed. So it's very important that you not intake too much sugar foods. Eat more plant-based foods, and that's in the Mediterranean diet as well. And those are foods that are from plants, vegetables, fruits, beans, legumes, and those sort of foods. They reduce inflammation. And I think we can go to the next slide now. Okay, vitamin D. So I have some information to tell you about vitamin D that's not actually on this slide. However, vitamin D is very important. And we learned in 2009 at one of the CMSCs, I can't remember where we were, but we had a whole Saturday, a whole day talking about environmental factors for MS, and vitamin D was the most important thing. Vitamin D affects cell function in the immune system. So your immune cells are always circulating the body looking for vitamin D. So if you are deficient below 30 in vitamin D, and you're very low in vitamin D, that's when autoimmune diseases start. So vitamin D suppresses the activity of those pro-inflammatory cells in MS. So those pro-inflammatory cells that cross the blood-brain barrier and go into the spinal cord and the brain are suppressed by vitamin D. Vitamin D levels have an inverse relationship with MS disease activity. So if your vitamin D levels are up or high, or over 50, then that disease activity is going to decrease. And if your vitamin D level is low, then worsening disability can occur. So there are ongoing studies evaluating vitamin D as an adjunct therapy, not just as a supplement we tell you to take, but they're looking at it as an adjunct therapy, just as important as your disease-modifying therapy. So know your level. The optimal level for MS is between 50 and 70. Some physicians say even higher than that. But know your level, talk to your doctor, and ask him what dose you should be on. So vitamin D3, that's the over-the-counter kind, is preferable to D2 because it's more water-soluble. It is more effectively used in the body, and it brings up your levels more efficiently. The surprise thing I want to tell you that's not in this slide deck, but I was reading today about vitamin D, and I learned that at Northwestern University in Chicago, they've been studying the effect of vitamin D on COVID-19. They have proposed that a level of 40 to 50 may protect some individuals against getting viruses, and they've known that for a long time. So they got interested in what its effect would have on the COVID-19 virus. So remember, COVID-19 hit the United States on January 20th of 2020, and it just went through our country. It just savaged our country. 80% of people that get COVID have mild disease. 20% have severe, life-threatening disease, especially older, over 65. Who carry multiple diseases. We call those comorbidities, who have multiple diseases like hypertension, heart disease, lung disease, and diabetes. So as far as MS patients, the National MS Society recommends that we follow the CDC guidelines. They do not feel that you should stop your disease-modifying therapy. I have people all the time that think they should stop their therapy, but you should not stop your therapy because MS is a disease of an overactive immune system. You need to be on your treatment because with some of the treatments, if you stop them, you'll have a relapse or disease progression. So they're saying do not stop your treatment, but you have to consider several things. If you're over 65, and you have comorbidities like heart problems, hypertension, asthma, COPD, diabetes, then you may want to talk to your doctor, especially if you're on a disease-modifying therapy that is a cell-depleting therapy, like Ocrevus or like Lemtrada. There are some that delete cells, and so those you have to be cautious about that. So you should talk to your physician about that. But remember the CDC guidelines for COVID-19. Stay 6 feet away from others. That's 2 arms lengths away from others. Wear homemade or professionally made masks. They should cover the nose down below the chin. I'm a nurse, so I have an N95. So it covers the nose and it comes down below the chin. And there are different sizes, so be careful. And then wear those when you're out of your home around others. And then avoid touching your eyes. They say that the easiest way to get COVID is to go out and you touch other things than you touch your face. And that's how they're saying now that many people get it. Stay home as much as possible. If you're over 65, you should not be going out to the grocery store right now. Even the CDC is saying stay home as much as possible. Wash your hands frequently. You wash for 20 seconds. Use soap and water. If you have a good antimicrobial with 90% can delete viruses and other organisms, that's what you should use as well. In fact, when I wear my gloves, I wear them in the office, I will put my my antimicrobial on top of my gloves because, and then when I take them off, I do it again, and then I wash for 20 seconds. So at home, clean surfaces with disinfectants and do that every day, multiple times a day. So remember this, MS patients do not have a higher risk of COVID-19 unless you are over 65 and you have multiple disease processes that you're dealing with. So be careful. Talk to your doctor if you have any questions about that. Next slide, please. Okay, so make healthy life choices. It's very important that you stop smoking. Smoking is the enemy of every person who smokes. Smoking causes problems with lungs. It causes problems with your kidneys. It causes problems with your esophagus, with your GI system. Smoking, it causes increased risk of disability and worse long-term outcomes in MS patients. If you don't get anything else tonight about living healthy lifestyles, you should think about stop smoking. Chronic condition, and if you stop smoking, within a year, your lungs will go back to the pre-smoking state. Chronic conditions can make it more difficult for your immune system to work efficiently. If you're older and you have multiple disease processes, those are called comorbidities, then you may have a wore-out immune system because the more diseases your immune system has to deal with, the less efficiently it works, and that's called immunosenescence. Chronic conditions can lead to more relapses and faster progression to physical disability. Blood pressure or hypertension, heart disease, high cholesterol, depression, and diabetes and chronic lung disease are the chronic conditions that people with MS need to be cautious about. Next slide, please. Oh, okay. So in 2016, there was a Canadian study that looked at more than 23,000 patients with MS. The most common comorbidities for those individuals were obesity, depression, anxiety, chronic lung disease, hyperlipidemia, heart disease, and diabetes. I know a lot of people who are not depressed, but they suffer with significant anxiety. That's just as bad as depression. Mood disorders need to be dealt with, and you need to talk to your healthcare provider. Obviously, there was an observational study of 885 patients, MS patients, with 3 or more comorbidities at baseline, and they had 45% increased relapse rate over 2 years. So smoking cigarettes increases relapse rates, and other comorbidities will increase your relapse rate. That's almost 50%. That's significant. And if you take a disease-modifying therapy that's going to decrease your relapses and you smoke, you negate anything that disease-modifying therapy can do for you. MRI studies have shown that patients with MS who have one or more cardiovascular risk factor have increased lesion burden and advanced brain atrophy. So be aware of that. Okay, next slide, please. I just want to say, Stuart, I hope the electricity doesn't go out. We are in a terrible storm here in Central Florida, so I hope we can get through. So the impact of comorbidities on MS include brain volume loss. So if you look at this picture, these are 3 axial views of MRIs. The first one on the left is a healthy person who does not have MS. Look at that brain mass. In the ventricles, which are in the very center, you have 4 ventricles, 1 on each side. Those are very narrow in the healthy person. On B, the middle MRI is a patient who's had MS for about 2 years. And you can see that his brain is healthy, but his ventricles have started to widen. You can actually see the MS around the ventricles in that slide. C is a patient who has considerable atrophy of the brain. This is a person who's had MS over 20 years. It's not known whether they went on treatment or not, but I would venture to say this person did not have treatment. This could be someone whose MRI was way before we had treatments. Now we have like over 20 treatments or 20 options for treating MS. So just remember that thyroid disease decreases brain volume, type 2 diabetes decreases brain volume too. So if you're dealing with those, in addition to MS, it is a very difficult battle for sure. Next slide, please. We have to work harder for you to keep your brain healthy. Mindfulness. Mindfulness means, many of you may think of mindfulness when people do yoga or meditation, sitting on the floor with your legs crossed. And so, but mindfulness can be many things and done in different ways. But it means maintaining a moment-to-moment awareness of your thoughts, your feelings, your body's sensations, surrounding environment through a gentle, nurturing lens. So you're trying to be very quiet, think about your thoughts yourself, what's going on around you in a very quiet manner. Mindfulness involves acceptance, paying attention to your thoughts and feelings without judging them, without believing there's a wrong or right way to think or feel in a given moment. Those that teach mindfulness say that when we practice it, our thoughts tune into what we are sensing in the present moment rather than rehashing the past or imagining the future. So that is what many people do. They're saying now, next slide please, they're saying that mindfulness can decrease blood pressure, it can slow your heart rate. It may decrease cognitive decline from aging if you're an older individual. It may improve our immune response. This is really key. If it could improve our immune response by impacting the immune cell function, those disease-fighting powers, that would be a very important thing. Mindfulness may reduce cell aging, and it may help reduce psychological pain and reduce anxiety, depression, and stress. So if you are a person with anxiety and stress and depression, mindfulness might be an opportunity for you to do something about those. But those are issues that you really need to be assessed frequently and by your physician. Next slide, please. Okay, the benefits of lifestyle changes. Aerobic exercise positively impacts the volume of key brain structures. Vitamin D supplementation may decrease MS disease activity, and in the future we may see it become an adjunct to disease-modifying therapy. Smoking is associated with a decrease in brain volume and increase in cognitive impairment. Structured cognitive rehabilitation promotes cognitive improvement. So structured cognitive rehab is done by speech and language pathologists and also by occupational therapists or with psychologists as well. So reading and lifelong intellectual pursuits can slow gray matter loss. I thought that was wonderful because I read a lot. My husband and I both read a lot. I usually read in medical journals and he's reading novels, but reading and lifelong intellectual pursuits can slow gray matter loss and cognitive decline. And they think now that people who have more lesions in the gray matter and gray matter loss are those that have significant disability. Mindfulness may improve the quality of life and may be a beneficial intervention for stress and symptom relief. Next slide, please. So before I talk about hope, I did forget to put my relapse slide in. So let's talk about relapses. Do I have time? Stuart, how's my time?
Your time has got 6 minutes.
Okay, good. 6 minutes, I can do it. So relapses, as you know, are new symptoms that occur or worsening of old symptoms you've had in the past that occur, and they remain over a 24-hour period. Now, these symptoms may be neurologic. They should be neurologic. They can affect vision, movement, sensation, bowel, bladder function, and it's unpredictable. They're unpredictable. They come on. You don't expect it. But I know that you should always call your healthcare provider, because let me tell you what, I would prefer to treat a relapse, even if it's just sensory, or consider treating it, because relapse symptoms can evolve over a month, over 30 days. So that means that inflammation in your brain, in your spinal cord, can be extending over a period of 30 days. So we want to manage those relapses. And so there are several things you can do. You can make the choice to do nothing and wait and see if it resolves on its own, or you can take IV Solumedrol 1 day times 3 or 5 days. We also have oral prednisone, which is the Canadian protocol, which we use on occasion, like now when IV centers were closed. Or you can use Acthar gel. Acthar gel is adrenocorticotropic hormone, and it's made by Mallinckrodt, the company that is sponsoring this meeting. And I use quite a bit of Acthar gel. It is given by one small injection, sub-Q, a day for 5 to 10 days. It works rapidly and it stays in the body for up to 12 weeks. So if those symptoms evolve over that 30 days, Acthar is there to work. And Acthar has similar side effects to IV Solumedrol, but it tends to work very well, and especially in people who don't have any IV access, or individuals who don't tolerate Solumedrol. So Acthar gel doesn't tend to have as severe reactions or side effects as Solumedrol, and that's why I like Acthar. Okay, so if you have any questions about Acthar in that moment, when we do questions, I'll be glad to answer. So hope, always like to leave you with the element of hope. Sees the invisible. It feels the intangible and achieves the impossible, and hope anchors the soul. Okay, Stuart.
Awesome. Thank you, Connie.
You're welcome.
Thank you very, very much. I'm glad you got into those relapse, into speaking about that as well.
Yeah.
So, yes, again, thank you for all this, and we're going to give Connie a round of applause, all right? So, here we go.
Stuart, if anybody wants the content, you can I get it from you?
We will be.
Okay.
Yes. And I was about to tell them that too, because one great thing about the videos that we do, everything that we do on virtual, we then transfer to our YouTube channel. Okay, so there is, for anybody that does not know how our YouTube channel works, well, go to www.youtube.com/MS Views and News. All right, and you can also find this from our website, our blog, our newsletters. You can always just send me an email and ask, all right? And we'll give you the same information. So on the YouTube channel, we do have different listings of different types of videos, one of which is our virtual events. And so that's where this will go to somewhere in the next 48 hours, somewhere between when this ends and 48 hours from now, it'll then be published to our YouTube channel so everybody else can see it as well.
Okay.
All right? Okay, great. And then everybody can catch your all your different slides. So now we have questions.
Okay.
We do have quite a few.
Okay.
All right. And one of them is, I have MS, but get kidney stones easily and often. I understand that higher levels of vitamin D can trigger kidney stones. Should I go for more? Should I go for more? I lost where it was. I'll let you follow it up from there.
Okay, and it is true that vitamin D is important for the metabolism of calcium in the body. So I have not heard that it increases kidney stones or renal calculi, but I'd consult my physician about that. In fact, in all the years that I've been doing this and giving people very high doses of vitamin D, I haven't had any that had kidney stones. So I would question that, but I'm not going to say that it's not true.
Great, thank you.
Sure.
Another person writes, should I be certain that my MS physicians are monitoring my vitamin D level with my other lab work?
Absolutely. Every time we do lab work in the MS Care Center, we do a vitamin D level. You should have a level at least every 6 to 12 months. Even if you're on a drug that doesn't require labs. If your neurologist doesn't do it, it's probably because he's expecting your primary doctor to do it. So one of those needs to monitor your level, definitely.
Great, thank you. All right, the next one is, how do people over 60 get back reserves that we've already lost?
Well, if you have lost neurologic reserve, I think it would be very difficult to regain it. But you need to be conscious of preserving what you do have. Now, there are some things that can be done, like if you're thinking of cognition and having problems with cognition, you can do remediation, you can do programs to help improve your cognition. And there's a lot of things you can do actively, intellectually, that may stimulate your brain in a lot of ways that are very helpful. But if you've lost brain matter, if you have a lot of MS lesions on the brain, it's going to be very difficult to get that back, but you need to maximize the use of what you have.
Okay. Next one, what symptoms warrant new MRIs?
Oh goodness, that's a big question, because if you have any new symptoms consistent with relapse, we always do an MRI. First of all, we order MRIs every year, whether you are stable or not stable. So, but if you have new symptoms and we're worried about progression of your disease, or we're concerned about new lesions, and we can usually tell with an exam. So a lot of times we have the patient come in and we examine them, and if there's any changes, we know something's going on in a particular part of the brain, then we will order an MRI. It's very important. I know that in people who don't have the benefits for MRI, the MSAA does pay for one free MRI a year, and so we access that option quite a bit.
Great, thank you. All right, so a person wants to know about things to do with COVID and the immune system compromise, which you already spoke about. But I do have to say and tell everybody that on the MS Views and News website, we do have, in fact, we just posted, we published this morning a video that Dr. Aaron Boster did yesterday at my request. I asked him to make a video about patients being not compromised, and he explains it best. So
Yes.
that is there on the website, as well as a link to either the National MS Society or the MS Coalition's page also, that does give a listing of the different medications and so on, you know, how the medications can affect what's going on with COVID-19.
So
Okay.
I do want to reiterate that MS patients are not more susceptible to COVID than the general population. But again, your age and the comorbidities you carry can impact that. Okay.
Correct. Thank you. So for anybody who wants to know right away, to reach our website, it's just www.msvn.org. That's msviewsandnews.org, you know, so nice and simple, okay? All right, next, we have, well, let me read this one from that somebody wrote in here, and then I'll get to the ones that are in writing, and that is, people with MS often have neurogenic bladders where the nerves don't work properly, causing them to make only able to hold lower amounts of liquids, and what liquids they can hold are released on a frequent basis, and 9 glasses of water a day will make them live in the bathroom.
So you have to take care of that bladder dysfunction. So there's 3 types of bladder dysfunction. One is inability to empty. That's where the sphincter doesn't open and you hold urine, you hold urine, you hold urine, and the only time you release any is to make yourself more comfortable. That's a natural phenomenon that the bladder does. The other is when you have urgency and frequency. And sometimes when you go to the bathroom, you just let out a little bit. That can be one or the other of those types. The third type is a combination of both of those, and that's a little bit more complex to treat. But if you have urgency and frequency, then we have medications we can give you that will help you not to hold more urine and not go to the bathroom so frequently. And especially if you're getting up at night multiple times, then we want to take care of that because that can impair your sleep, and that's a bad thing as well. The other thing is that if you cannot, if you have to sit and push on the stomach and you have to really try to release the urine, then we may need urodynamics for that. And sometimes we send you to a urologist because there's no medication we can give you, but there are some that he can give you.
Great, thank you.
Okay.
All right, next, I just wanted to add that, let me scroll through this. One person wrote a lot of stuff, but I can't read all of it on here because it would just be too much. So let's go to what's next here. How do you tell if your relapsing remitting MS has changed to SPMS?
Okay. There are some ways, and sometimes it's difficult, but patients will have, relapsing or remitting is when you have a relapse, you get better, you have a relapse, you get better, you have a relapse, you get a little bit better, but you keep some level of that relapse, and that goes on over time. And then as time moves on, you have fewer and fewer relapses, but you have more progression of your disease. So patients will come in and they'll say, I'm having a relapse because my walking's getting worse, my vision's getting worse. We do MRIs and there's no change on the MRI. So that is one indication. The other is if we give you steroids for what we think is a relapse and the steroids don't do anything to make you better, that's another indication of secondary progressive. So in secondary progressive, you have fewer relapses, but you can still have a relapse, but you tend to have more progression. So here's the caveat. So when you're young, or anybody young listening on and you have MS, this is the time to take charge of your disease, because what happens in the first 5 to 10 years with this disease is going to affect you later. So those lesions that developed way back then are going to be causing the problem during secondary progressive disease. So be sure to be on a disease modifying therapy, do your healthy lifestyles and wellness, take care of all of those to maximize your outcome.
Great, thank you. Next person, do I have a higher, this person was asking, I think maybe you want to reiterate, does he or she have a higher risk of getting coronavirus?
Just because you have MS, no. Let me tell you, the optimal situation for MS would be if you are on vitamin D. Not that you take it one time and stop. You have to be on it for a period of time. So if you're on vitamin D and your level is over 50 and you don't have heart disease, diabetes, high cholesterol, lung disease, then you may not be as high a risk for COVID-19 as those that are over 65 and have other diseases that they carry. The other thing is just don't stop your disease modifying therapy unless your doctor tells you, because what can happen is you can have a rebound effect and you can have a severe relapse if you suddenly stop it.
Okay, next, how do I know if relapsing or just old symptomatic symptoms occurring because I'm in a stressful time?
Yeah, stress, the enemy of MS. So stress it's remarkable what stress can do to the individual, to the mind. And so if you're under a lot of stress, I had a lady the other day who's going through marital issues. She said she wasn't depressed, she wasn't anxious, but boy, did she have a lot of symptoms that she'd had in the past that had come back. So I think there are ways to manage stress. You may need to get some professional help with that. But don't let it ride. You need to do intervention. Talk to your healthcare provider and see what he suggests. There may be some things that he can do. He would know you the best that he can do to help you learn to release some of that stress. And, you know, psychologists have great mechanisms for that. They have tapes you can play, mindfulness you can do, and a lot of that will release stress. But stress, there was a study way back in, I think, 2003 in Europe. I think it was 2003. And they looked at stress. Stressful events that last 6 weeks or more can lead to a significant relapse from that study.
So Connie, thank you for that, but I have a great question for you. Person
Okay.
wants to know if he or she is losing their short-term memory, but he or she is 71. Is this MS or age-related?
So hard to tell. So hard to tell sometimes. So what we would look at certainly the MRI. What does the MRI tell us? Do you have a gray matter disease? Do you have a lot of lesions? So over time that can affect. But there are things that happen as we get older. I'm 71, so I know exactly how that feels. Every time I can't remember a word or I can't remember somebody's name, you know, I think it's age related. But it is true that that is an age related factor. So talk to your healthcare provider about it. There may be some things that you can do. I think that people over 65 should be doing crossword puzzles. There's all this kind of, there's one little game, a numbers game, I can't understand. My daughter plays all the time. Read books, do all those things to stimulate your mind, and you may find that they make a difference in with your cognition.
Great, thank you for that. Scrabble, I love playing Scrabble. I'm online playing Scrabble.
I'm the worst.
I've got 25 games going at a time.
Oh my gosh, you play online then?
I play online, and it's
Stuart's
incredible.
a gamer.
People know that it's going to take me a while to get back to the first game when there's just so many to do, right?
That's really good for you.
So going forward, and before I ask you the question, people are asking about telehealth, all right? But this is something else. This is something else that we have on our website, all right? In fact, I did a video at the beginning of this pandemic with one of our leading MS neurologists in the country, and we did an actual phone call, an actual telemedicine call. Amazingly, he played the MS neurologist, and amazingly, I played the MS patient, and we did a real call, and we video recorded this, and you could see this online, so you could get an idea of what an actual telemed call looks like. But so now this person would like you to explain about telehealth.
Okay, so we started doing telemedicine in March of this year. I was the first to leave the office, and then shortly thereafter our doctors left. And we started doing telemedicine. So in telemedicine, there's a lot that you can do. You can talk to the patient, find out what's going on with them, see if there's any new symptoms, see if there's any stressors in their life. Of course, COVID-19 is a stress in itself. We see if they're abiding by the COVID CDC guidelines. And then you can also assess them. There's some things that's hard to do, but if you have a patient, get very close to the camera like this, and you can check their eyes. Then you can also have patients pick up things to see if their strength is good. You know, pick up that chair you're sitting in, stand. Can you jump up and down? And there's just a lot of different ways we can test. It's not perfect, but it certainly is an answer. And you know, there are people that have been doing telemedicine for years. I have a nurse friend who's a PhD up in the Northwest. Remotely, she is out there by herself, and she does a lot of telemedicine because people live so far they can't come into the center. So for us it's new, but for a lot of people around the country it's not a new process. So But there's a lot of assessment we can do, and I watched that video that Stuart's talking about, and he does a great job assessing patients over the telemedicine. You should watch it.
Yeah. In fact, the patient was really good.
Yes, he was.
Yeah. Thank you. All right. So going forward, a person has been writing to me. She's wants to talk about alcohol's effect on the MS brain and how that compares with the smoking, and wants to know if alcohol use is worse than smoking or if it's about the same or whatnot, and that because with what's going on with pandemic and so much going on with people drinking a lot right now, there's going to be quite a rise in Alcoholics Anonymous probably later on in life. But can you tell us more about the alcoholic effect on the brain?
Yeah. So alcohol is, so our patients always say, "Can I keep drinking?" And of course, I have a lot of young patients. Some are in college and they want to drink on the weekends. And so I let them know that the alcohol after 2 drinks, depending on how hard the liquor is, your MS symptoms are going to be more embellished. If you have imbalance of gait, that's going to be worse. If you have problems with vision, that's going to be worse. Doesn't mean that it's going to be permanent, but you have to be very cautious of where you are and when you drink. We prefer our patients not have more than 2 drinks, alcoholic drinks in one day. But alcohol, to the point of being an alcoholic, can damage the brain. It can damage the brain cells. It damages the liver, and it really does a lot of damage to your immune system. So is it as bad as, what was it? As bad as, Stuart, what was the question? Was it as bad as? Smoking. Well, I think there's probably not been as many studies on alcohol and MS as there have been on MS and smoking. So we know that smoking is the devil. It's a disaster for MS. It is an absolute disaster. But alcohol, over ingesting alcohol can also damage your liver as well as your kidneys, and as well as you can actually lose brain cells if you get to an alcoholic state. Okay.
Okay, thank you.
Yes.
All right, what can you tell us? What information could you share for a cure?
I lost you for a
It's
second.
a loaded
Stuart.
question. Did you hear me?
Yeah.
Oh, okay, sorry. Must have been all that
That's okay.
thunder.
Is it? Yeah.
We have
The
lots.
weather.
We have lots of thunder going on now too. Okay.
Oh, okay.
What information can you share with us about new medications and research for a cure?
Well, I can tell you that we now have over 20 new treatments out there. I think that, and then there are more that are coming out with different ways to give it. For instance, ocrelizumab or Ocrevus is an IV infusion every 24 weeks. And they're looking at an oral ocrelizumab as well. The siponimides are like Gilenya and siponimide. Those drugs are being duplicated by different pharmaceutical companies. And so those are being studied. The monoclonal antibodies, and I can't remember all the mumabs out there, but there's ongoing research in all of those. Like Tysabri is a monoclonal antibody. Ocrevus is a monoclonal antibody, and so a lot of those are coming out. They do affect different cells, CD marker cells and so forth, but it seems to me that the siponimides and the monoclonal antibodies seem to be the way to go, and you'll see more of those coming out and more ways to administer, like oral versus IV or injectables and so forth. And I can't remember that last question. It's hard to keep up with all the treatments now.
With all the what? With all the treatment? Well, the question was just what research is there for a cure?
I think that I'm being honest in saying that now, there's always research looking for a cure, but I think the majority of research is going to better ways to treat it at this point.
Okay, thank you. A person writes, The person writes, my 25-year-old son was recently diagnosed with MS, and I would like to learn more about the treatments. So where can you tell her to go? I would tell her to go to the MS Fusion News website.
Yes, and the MS Society website.
Great.
And so I think you'll find a lot of detailed information, side effects, you know, and that sort of thing. And what's good for one person may not be good for another. Remember, every patient with MS is different. No two patients are alike. What Stuart may take for MS may not work for you, may not work for another individual. The key is to finding the right drug for the right patient. And so sometimes that takes a while.
Okay, great. Thank you. Here's an interesting question, and I've heard this many times in many circles, and I don't know if there's an answer for it yet, but a patient would like to know, when a vaccine is found for COVID-19, will they be able to take a live version, or is there going to be a separate dead version as well?
That's been a big question. And in fact, I think I heard the president ask that question a couple of weeks ago, and I don't think he could answer. I mean, I don't know. I think that virus vaccines, for the most part through history, have been live vaccines. But we now have a flu vaccine that is dead. And so that's the one we have our patients take now. So I can't really answer that. I think all of those questions are going to be answered by the fall of this year. There's some that are researching the dead virus that may not work, and there's some testing the live virus that may work. So I think whatever's going to come out is going to be the first one that works.
Great. Feeding off of that, person wants to know that being over 70 years of age, should that person still do a vaccine if a vaccine is developed? Or is it being older put them more at risk?
Well, I just listened on the CMSC program today, Stuart, and it's on the website if you didn't get to watch it, about vaccines. And so the question is, live vaccines work differently than dead vaccines. So if it would put you at risk, that would be a question for your doctor to answer, and only your doctor knows you the best. So we tend to not want our MS patients to get live viruses because it can stimulate a relapse. However, I think the severity of the disease, of the virus disease, may outweigh the benefit of taking the vaccine, and that would be your doctor, your primary doctor, or your neurologist would have to determine which is best for you.
Okay. Changing subjects a little bit. Person would like to know if it would aid he or her to push on their belly when they're having problems urinating to help the flow.
Okay, so it depends on how hard you have to push. However, have your doctor order a physical therapy evaluation by a physical therapist that teaches Cadet. So there's a method where you can touch the inner thighs, and that helps to release urine. I know some patients will bend forward, and that's if they have a prolapsed bladder where the bladder leans backward. The majority of the urine may be at the back of the bladder, and if you lean forward, that will stimulate urine to come out. So I think learning some of the techniques that are available out there by a physical therapist that teaches them, and getting the advice of your urologist would be better than me telling you to press on your stomach or how hard. You could hurt yourself.
Thank you.
Okay.
You know, it's funny that you said about leaning forward, because I notice guys as they get older, as they get older, they have to lean more forward in order to make that flow work better in the right direction too.
That's right. That's part of that stimulation, right?
That's right. A person would like to know, and I don't know why that this person does not have the information in their area, but they want to know if there's anything on the horizon to treat PPMS.
Primary progressive?
That's right.
Primary progressive MS. Well, we have one. We have a treatment for primary progressive MS. It's called ocrelizumab, and it's an IV infusion every 24 weeks. And that's the first treatment for primary progressive MS, and it works very well and decreases disability progression. And also with Ocrevus, many patients improve by about 25%. So you talk to your neurologist. You can't get it at home. You have to go to an infusion center to get it. And then there are others coming out soon, like the oral version and that sort of thing. Some of the MAPs might be for primary progressive MS.
So what about Supposia?
Okay, I'm not familiar with that. Who's putting that one out?
That is Bristol Myers, formerly Celgene.
Oh, yes, Celgene.
That's right.
Well, Celgene's for relapsing, isn't it? Secondary progressive?
I don't remember what's on the label, but I guess that's the ozanimod. And I don't remember what it's for at this very moment.
I'd have to read about it. We are not doing that. We do a lot of research, but I'm not involved in that research in our office.
So whoever it is that is asking that, we do have that also on our website. If not the website, it's on our blog and maybe in our last newsletter or whatever. But I could get you that information as well. I could send it to you.
Okay.
But you could just go to supposia.com. All right. And just go right to supposia.com and it'll tell you about that information right there. Okay.
Yeah, I thought that one was for secondary progressive. I could be wrong.
Okay. And then another person said something about, please use the drug name. Ocrevus is 24 weeks. I think it was said that it was 24 weeks. I'm pretty sure Connie said that before. So,
yeah, it is 24 weeks.
Ocrevus is also known as ocrelizumab for anybody that's confused there. Yeah. And then our very last question, okay? Is there an age where relapses decline or stop altogether?
Not an age, but as you have MS over time, they will slow down. It can be secondary progressive MS can occur in anyone. Usually doesn't occur till about 10, 15 years. And some people it's 20 years. But over time, and they older doctors who are now retiring, they used to call it MS burnout. But we've learned over the years that MS never really burns out. But the longer you have it, the relapses may slow down over time. But that's not true of everybody, but in some people.
Okay, great. There are a couple of other questions going back to the COVID stuff, things to do with the types of MS. Again, that's available on the websites of every MS organization. Okay, it doesn't matter which one you go to. You know, I don't care. You can go to our website, but if you don't want to use our website, you want to go to the National MS Society or the MS Foundation or the MS Association of America, it's your option, all right? But we all have information listed there about the different forms of multiple sclerosis, the different medications, and again, you know, we have videos there as well if you use our website. As far as the healthcare workers of the world right now, I do applaud every healthcare worker that, whether they're on the front lines or the back lines, whatever it is that they're doing, we do want to thank everybody out there for doing everything that they can do right now for everybody with COVID, without COVID, hopefully never getting COVID. All right. We do appreciate everything that everybody does. All right. Connie, I want to thank you again for doing this program, and for everybody that's still listening. We do have 2 virtual programs happening next week. You will find them on our website. All right. One is MS Neuro TV, and that will, I don't remember who's speaking at that one. And then I will be with Dr. Rick Harris next week, and we're going to be speaking about things to do. He's a psychologist, and we're going to be speaking about things that have to do with MS and the impact on the family. Okay. So again, I want to thank everybody. I want to thank Gretchen for doing this tonight. I want to thank Connie for doing this tonight. I want to thank our 90-something people that were online tonight. Thank you, everybody, for being here. I want to thank Bill, of course, and Jennifer, okay, that helps put together all of this. Yes, we have a great team, and we're going to keep on plugging along, all right? So, again, thank you, everybody, for being here, and let's say good night.
Good night. Stay safe out there.
That's right. Stay safe.